So welcome everybody. It's good to have you here, and I'd especially like to thank Chief Martin for having us and letting us and hosting us here. I appreciate this very much. So the message today is across Pennsylvania, the Pennsylvanians, the citizens of Pennsylvania, are doing their part to face up to the challenge of COVID-19. We're all trying to do our best to keep our families safe, keep ourselves safe, keep our neighbors safe, keep our communities safe. And our first responders are working overtime, literally, to protect us during this crisis. And they're doing this, often putting themselves at great risk. But by doing everything we can to reduce the spread of COVID-19, everything we 13 million Pennsylvanians can do, we civilians, we can return the favor. We can return the favor to these first responders, and we can keep our law enforcement officers safe. And that means primarily, first of all, wearing a mask, doing what you're all doing right now, whenever we're in public. I think most Pennsylvanians understand the importance of mask wearing during this global pandemic. I think Franklin and Marshall College just did a survey recently that said that, 2/3 of Pennsylvanians believe it's extremely important to wear a mask whenever they leave home, because they know that our best chance at keeping COVID-19 from threatening our lives is to keep the mask on. And that's why Dr. Rachel Levine and I, who you'll hear from in just a minute, and I have issued an order making mask wearing in Pennsylvania mandatory. These orders do give us the ability to cite folks who aren't taking this precaution, if that's what it's going to take to keep Pennsylvanians safe, and that's what we'll do. We're already working with businesses to ensure that they're in compliance with the COVID-19 mitigation efforts. The State Police Bureau of Liquor Control Enforcement conducts hundreds of compliance checks every day at licensed liquor establishments to ensure that licensees are complying with masking, with social distancing, and with other requirements. Pennsylvania Liquor Control Board has provided guidance to bars and to restaurants, and they notify notify the Liquor Control Board when they have citations or give citations. And depending on the level of infraction, the Pennsylvania Liquor Control Board could suspend a business's liquor license, and further enforcement could put the license at permanent risk. The Department of Agriculture, you're going to hear from the Secretary of Agriculture in a minute, receives and they investigate complaints of non-compliance with the mitigation orders. That includes prohibitions or limits on dine-in services and masking requirements. They're responding to the issuance of warnings and fines. And of course, the Department of Health is receiving other complaints or other notices of possible violation received from residents and workers and who are concerned about where they're working, and they take appropriate action. And we're also working with local officials where that's appropriate on enforcing the mitigation orders. If we want to have our best outcome, though, this doesn't depend on enforcement. It depends on our doing what we do because we understand how important it is. We need to be guided by our self-interest here, not by enforcement. It's just like seatbelts. We wear them because they actually protect us, not because there's a law. There is a law, and it's enforceable. But seatbelts protect us because we choose to wear them whenever we get into a car. So I'm calling on every Pennsylvanian to do their part to help us get as close as we can to 100% compliance in this effort. Not because it's the law, but because it actually is the respectful thing to do. We need the help of our business owners to order folks to wear masking when they come into their places of business. We need the help of our local elected officials to emphasize the importance of wearing a mask, keeping our communities safe. We need the help of our religious leaders. We need the help of our community leaders, everyone to stand up and say, come on, folks, this is important. And of course, we need the help of every individual Pennsylvanian to make a decision each and every day to wear a mask. As I said, 2/3 of Pennsylvanians are already very active in wearing a mask every time they're in public. And I want to thank each and every one of those Pennsylvanians because you are the ones make this work. You are the ones keeping people around you safe, keeping all the rest of us safe. We now need to come together. We need to unify. We need to work together to defeat this virus. That's the enemy. And the way to do that is to wear a mask. So thank you. Now I'm going to turn things over to Secretary of Health, Dr. Rachel Levine. Dr. Levine.
Well, good afternoon. Thank you so much, Governor. Here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 565 new cases of COVID-19, which brings our statewide total to 114,155 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. Tragically, we've had 7,209 deaths attributed to COVID-19 in Pennsylvania. The actions the governor and I have taken to require masks and reduce the number of people coming together in one place are designed to be surgical and precise to prevent from repeating the cycle that we saw in the spring. We have gained a great deal of experience since the start of this outbreak and have learned from best practices from other states as well as other counties in Pennsylvania. We know that COVID-19 has created stress on our community really unlike anything we have seen before. This virus is extremely contagious, and it's really, of course, so small that it can only be seen under a special electron microscope. Within minutes of letting down our guard, we can make each other sick by passing the virus on from one person to another. We cannot let this virus win. We cannot let it divide us. So when you wear a mask, you are doing more than just complying with the law. You are actually telling the brave men and women who keep our communities safe, like Chief Martin and the members of the Susquehanna Township Police Department, that you care about their health and safety too. We must stop the virus transmission cycle to prevent it from infecting our friends, our loved ones, and our community. Right now, you are stopping the spread when you wear a mask. Right now, you are stopping the spread when you avoid large public gatherings. And right now, you are stopping the spread when you use hand sanitizer and wash your hands frequently. When you are out and about, if you're thinking that you might need a mask, you need a mask. Pennsylvanians want to be at work, and Pennsylvania school children want to be at school. But our actions collectively as a community will directly impact us being able to do those things. So be safe. Adapt your activities to protect against the spread of COVID-19. And please, please wear a mask. What is most important for Pennsylvanians to remember is stay calm, stay alert, and stay safe. And now I'd like to introduce my friend and colleague, the Secretary of Agriculture, Russell Redding.
Dr. Levine, thank you. Good afternoon, everybody. Governor, thank you. It's great to see you. It's great to be with you always. A special day to talk about an important topic here again. And I appreciated the introductory remarks of the Governor. The appeal to us as individuals is the key. Before COVID-19, most of us took the restaurants for granted. Even though we ate most of our meals outside, right? Half of those were away from home in these restaurants. They were convenient, they're social, there was someone else doing the dishes. We loved our restaurants. We still do. The pandemic, though, has shone a light on just how valuable restaurants are in the daily lives of each of us, and certainly in our food supply. Sitting in a restaurant enjoying a meal feels almost normal. But we're not back to normal, as you've heard. Our health experts, the science, our experience tell us that if we wear masks, it makes a difference. We need to wear the mask and continue with our mitigation efforts. It's how we protect the restaurant workers, the patrons, and each other. The Department of Agriculture's food safety inspectors enforce the Pennsylvania Food Code, ensuring that food sold in Pennsylvania is safe to eat. As part of our food safety responsibilities, the Department of Agriculture's food safety inspectors will be collaborating with the Department of Health through a memorandum of understanding that gives our inspectors legal authority to enforce the Disease Prevention and Control Act in Secretary Levine's orders. So think of it this way. We are taking the authority of the Secretary of Health and placing that with our inspectors who are in the field inspecting each of our restaurants to keep us safe. This team approach will help ensure that both our food and those who serve it are safe. Our food safety inspectors will note violations and issue joint written warnings with the Department of Health and citations, not just under the Food Safety Act, but also under the Disease Prevention and Control Act. Food safety inspectors will conduct their normal inspections at random and in response to complaints from the public, just as we do now, just as we did prior to the pandemic. That's important. While in a restaurant, they will note compliance with the order, which requires posting of signs, requiring patrons to wear a mask, requiring restaurant employees to wear masks, adequate distancing between tables, bars within restaurants to be closed, and packing customers in too tightly. Our restaurants have faced tremendous challenges to stay in business and protect their employees and customers. Most of them have taken every precaution to follow the orders and protect customers, and we thank them for that. We appreciate their sacrifices in so many ways. Pennsylvania's restaurant owners and staff have delivered for us. We can all now deliver for them by wearing a mask and following COVID-19 measures to keep them safe and healthy. Please, don't put the workers in these restaurants in the awkward position of having to ask you to wear a mask. That's not fair. It's not fair to them, and it's not fair to the folks around them. Please, just be kind, as the governor has noted. Patronize the restaurants that are doing the right thing. They deserve our loyalty. Plan ahead, make reservations if possible. Use the curbside service when available. Make sure you tip them generously. Let's support our restaurant owners and workers and show them that we value what they do for us. Let them know that their loyal customers will be there, and we want them to bounce back just as quickly as we can to get to normal. So together, we're in this, and together we'll win. Thank you. Pleased to introduce Lieutenant Colonel of the Pennsylvania State Police, Scott Price.
Good afternoon, and thank you, Secretary Redding, for the introduction. Thank you all for being here to help us share an important message today regarding common sense, evidence-based COVID-19 mitigation efforts and the roles we all play in education and enforcement. Since the middle of March, the Pennsylvania State Police and our local law enforcement partners have taken on a somewhat uncharacteristic role for us, assisting to slow the spread of a pandemic, the likes of which our country hasn't seen in more than a century. As some of the most visible first responders in the Commonwealth and in our communities, it's a challenge our department readily accepted because first and foremost, we view this as germane to our public safety mission. As many of our fellow citizens were acclimating to working from home to limit exposure, we were working to develop policies and procedures to allow our troopers to continue to provide vital services, maintain day-to-day operations, and increase our visible presence within our communities. These efforts, we hope, continue to provide a sense of reassurance during these difficult times. From the beginning of this pandemic, PSP endeavored to strike the appropriate balance between education and enforcement related to COVID-19 mitigation orders, something heretofore unknown to all of us. We believe, as does the governor, the vast majority of Pennsylvanians want to do the right thing to protect themselves, their families, friends, and neighbors. But we also understand these are stressful and confusing times for many of those we serve, as information about the coronavirus and the COVID-19 illness it may cause continually evolves. We also realize people are concerned not only about their health, but their livelihoods. We've seen secondary effects to include mental health crises, and some correlation with increases in suicides and drug abuse. And we know we can't cite or arrest our way out of this pandemic and its impact on Pennsylvanians. At the same time, however, the very real threat of this public health emergency means that penalties may be imposed for persons and businesses willfully refusing to comply with the mitigation requirements outlined in the orders signed by Governor Wolf and Secretary Levine. In accord with our public safety mandate, PSP and our municipal partners were empowered to enforce the order suspending in-person operations of non-license-sustaining businesses and the statewide stay-at-home order, both of which have since expired. Nonetheless, we continue to respond to violations of the Worker Health and Safety Measure Order and have issued approximately 60 warnings since April 19th. Again, our goal is to achieve voluntary compliance through mutual respect of one another and not to unnecessarily involve business owners in the legal system. In addition to troopers across the Commonwealth enforcing these orders, I'd like to emphasize the role of 200 men and women of our department's Bureau of Liquor Control Enforcement. The majority are civilian state police personnel who enforce all aspects of the liquor code and work closely with licensed liquor establishments to ensure safe and responsible alcohol sales and consumption. They serve a unique role in monitoring and enforcing compliance related to licensing. The role of our liquor control enforcement officers is amplified today as restaurants and bars seek to reopen safely and welcome back patrons. The Liquor Control Board has mandated licensees abide by mitigation requirements, including mask wear by employees and customers, social distancing, and occupancy limits. And while a trooper or police officer may respond after receiving a complaint, our liquor control enforcement officers are able to take a more proactive role, visiting licensees unannounced to perform compliance inspections and rectify potential violations before a complaint has been made. Liquor control enforcement officers conduct hundreds of proactive in-person visits each day. In July, they conducted nearly 20,000 inspections statewide. To put that in perspective, there are about 15,000 licensed liquor establishments in Pennsylvania. Thus, almost every one was visited by a liquor control enforcement officer. As expected, the overwhelming majority of licensees have been in compliance, and most issues have been resolved simply with a warning or education. But if necessary, there exist penalties under the Liquor Code for flagrant violators up to and including, as the governor mentioned, suspension or revocation of one's liquor license. In closing, the Pennsylvania State Police would like to offer our appreciation to everyone who is stepping up and doing their part to follow the guidelines in place to mitigate the spread of COVID-19. Our COVID-19 response has been applauded by sister law enforcement agencies nationwide, and we hope it brings some measure of reassurance to those we serve to know that we continue working with the Pennsylvania Department of Health, Dr. Levine, the CDC, our department medical officer and command staff to ensure we remain at the forefront of law enforcement pandemic response efforts. We appreciate the support we've received during a most tumultuous time in the history of our Commonwealth, and our troopers and liquor control enforcement officers will continue to embrace our core values. We are PSP, people serving people. With that, I'd like to introduce friend and colleague, Susquehanna Township Police Chief Rob Martin.
Thank you, Colonel. Governor Wolf, Secretary Levine, Secretary Redding, welcome to Susquehanna Township, and thank you for choosing our venue for this press conference. Since the onset of the pandemic, all of us have had to navigate through these uncertain times. In late winter, when I saw the impending pandemic, I did what I often do to prepare for a crisis as a leader. I made a visit to history. Specifically, I began to read the fireside chats of President Franklin Roosevelt during the Depression and World War II. In April of 1942, a mere 5 months into World War II, President Roosevelt gave a fireside chat titled Sacrifice. He shared with the American people the need to sacrifice, and I quote, he wrote and said, "This is one front where every American is in action and will remain throughout. The front is right here at home, in our daily lives, and in our daily tasks. In Susquehanna Township, we are blessed with a first-rate public safety team, our sworn officers, the volunteers in our 2 outstanding fire companies, Rescue Fire Company and Progress Fire Company, the Susquehanna Township Emergency Management Service, as well as our fire marshal and EMA director have all been a blessing to this township over the past months. We're fortunate to have the support of a great district attorney in Fran Chardo, our county commissioners, and the resources available through the Dauphin County COVID Response Coordinating Committee. But despite those assets, public safety professionals in Susquehanna Township, and I'm sure is the case in every other jurisdiction in this country, have been tested by this virus in the past 5 months in ways we've never been tested before. A few examples. We've seen an increase in domestic violence calls and arrests, an increase in mental health calls and referrals to county and community-based programs, an increase in aggressive driving reports and moving violations. My intent here is not to sound overly somber, but to report to you the facts on the ground as we see them. The COVID fallout that public safety professionals face every day. While this pandemic and the sacrifices required to beat it have been all of us to a degree, the coronavirus hasn't broken us, and it never will break us. So as we all have sacrificed, we know the great Americans that went before us met crisis and made that sacrifice. Our citizens in Susquehanna Township have been inspiring. On many occasions, they have contacted our police department and our government center for advice, guidance, and our assistance. Our approach to calls relating to COVID have been one that is educational. We wish to meet our citizens where they are and be an educational voice of gentle persuasion. Of the times that we've had to make referrals to our Commonwealth partners, we have met with cooperation and understanding. So I want to thank the Commonwealth for being a valued partner. And specifically, I want to comment on the Liquor Control Enforcement Agency, which the Bureau of PSP, we've always had a fantastic relationship with them here in Susquehanna Township. And I was on the phone with them in less than 10 days ago, where they were absolutely outstanding. So I want to thank them for all the hard work they're doing. And I want to thank Governor Wolf for his always civil-mannered discourse, as what our country needs more of right now is civility. I believe in every crisis there is an opportunity to define civility and compassion, which has always strengthened the American spirit for cooperation and sacrifice. Governor, thank you.
Thank you, Chief Martin. Thank you, Colonel Price. Thank you, Secretary Levine. Thank you, Secretary Redding. Really appreciate all of your comments. And Chief Martin, you're absolutely right. This is a time that, whether we like it or not, we're fighting a common enemy, the virus, and all of us Pennsylvanians, Americans have to pull together, and it calls for some sacrifice and a willingness to work together to help each other. So thank you very much for those words. And with that, I'll open it up for questions. Yeah.
Governor, I'm wondering if today represents a bit of a sea change for you. In the past, you've said it's up to 12.8 million Pennsylvanians, which I'm sure you still believe, to do this, but you didn't want to get into enforcement issues. Today, it seems we're starting to talk a little bit about enforcement issues. Are you seeing or hearing that a lot of people are not?
No, I'm doing this because you kept asking all these questions about it. So I just want to make sure you understand that, this is like seatbelts. It's like stop signs. This is legally enforceable, but it's like everything else in our society. It basically works because almost everybody says, we're going to pull together here. We're going to do the right thing. We're going to stop at intersections. And here, this is new. It's a pandemic. It's a virus. It's very contagious. And if we want to protect our fellow citizens, I mean, again, when I wear a mask, I'm protecting you. You wear a mask, you're protecting me. It's the ultimate in actually a kind and decent gesture. You're paying respect to your fellow Pennsylvanians. And in the end, that's what's going to motivate. If all that motivates us is the idea that, out there's an enforcement mechanism, that's not going to work. It's going to work because we all pull together and say, in this fight against this virus, this common enemy that we're all facing, these are the things that work. Let's do it.
You're standing in front of police cars, so I'm assuming you're reiterating the message that there is an enforcement arm to this thing.
Yeah, I mean, I'm reiterating the message that this is not just sort of say, hey, let's just there is enforcement, and there always has been. As Secretary Redding said, we've been working for I don't know how many centuries to inspect restaurants, to make sure when you go into a restaurant that you can feel safe and that the food is not going to be contaminated, that you're not going to be contaminated by somebody else. This is something we now have in front of us that we didn't have a year ago. And so it calls for new rules to live up to. So yes, we will continue to enforce those rules to the extent we can. But again, what I've always been saying is it's what the people of Pennsylvania do each and every day that's going to make us successful in this fight against the COVID-19 virus. Yes?
Governor, this is a question about one of the main measuring sticks for the extent of the virus in the state. On Friday, I was looking at the Pennsylvania COVID-19 dashboard, the Department of Health website. About 11 o'clock in the morning, there were 756 people hospitalized. A little over 3 hours later, there were 522 hospitalized, so there's a drop of over 200. Now, I've had some back and forth by email with the department since then, and as I understand it, generally speaking, the state is realigning with the federal government some reporting issues. Could you explain, or can Dr. Levine explain exactly what that means?
Yeah, I'll let Dr. Levine. To keep in mind that you need to be a little careful with day-to-day fluctuations. For example, weekends tends to be a smaller number than not. So we use, and I think the CDC, most statistics talk about a 7-day moving average rather than just 1 day in isolation. But Dr. Levine, I'll let you talk about this.
Portrays itself to the public as the number of people currently hospitalized for COVID-19 in the state.
So you are entirely correct, though. So the number changed on Friday because our reporting mechanism changed. So previously, all the hospitals had been reporting to the CDC and reporting to Pennsylvania using a specific database. The White House and the Department of Health and Human Services federally is now requiring hospitals to report to them and using a different database. And so over the course of a couple of weeks, that reporting changed on order of the White House Task Force. And so to avoid having them have one data system for us and one data system for the Department of Health and Human Services and the White House Task Force, we're now using that same White House Task Force reporting system. There are still some challenges in terms of that reporting. It's only been a week or more. So we're going to be going ahead with that system, and we'll do everything we can to make sure that the numbers are all adding up. But it's a different reporting system.
What's the difference, though, if there were 756 people under the system you used, and there's 522 under the system the federal government wants to use? Does it mean that people who had some other dual diagnosis or something were being counted as COVID, now they aren't? Like,
I think that some of it is in terms of how the data is reported in each individual database, and which is different. And I think the hospitals are still learning how to use the new database. So we're going to be working, and we actually have contact with over 200 hospitals in Pennsylvania to make sure, and we'll make sure that that number is accurate as we're moving forward. And so a big change happened on Friday at the request of the White House. Yes, sir.
Governor Wolf, you cited an FNM poll when you were describing, the need for masks, and that poll did show wide agreement across the state, but it also showed an ideological divide. Liberals were more likely to leave the house wearing a mask than conservatives. What is your administration doing to take something that, whether we like it or not, has become partisan and make it nonpartisan?
Trying to do things like this, to say, listen, I don't care if you're Republican or Democrat, that virus is out to get us. It's sort of like, I keep saying gravity. I mean, it exists. It's not a Republican or Democratic thing. And so for some reason, I don't know why this has, you're right, and I think the Franklin Marshall poll showed this, it's become politicized, but I'm not sure why that is. If you're a Republican and you're a conservative, you're just as likely, all else being equal, to get this infection as if you're a liberal Democrat.
Your office put out a statement on Friday around the Russ Diamond statement. Without getting into that, you cited disinformation or misinformation from Republicans. Do you have examples of that? Like, what is your concern with Republicans and information they have on COVID?
My concern, again, is that we use any reason or excuse not to wear a mask. Whatever that reason is, I think we've got to avoid sort of saying this is Donald Trump or Tom Wolf or Secretary Levine mandating that we do this or don't do that. It's that virus. And that virus is out to get each and every one of us. And so I think, you know, it's an education thing. And if you looked at early on, we were pretty sure that wearing a mask in March and April made a difference. There were not a lot of people wearing masks. Now, 2/3, according to Franklin Marshall, think that we ought to wear a mask. I think more and more people do that. That's the way things tend to work with human beings. We internalize it. I'm not a psychologist. We internalize it and we figure out this makes sense to do, and I'm therefore going to do it. Yes.
The schools, I'm coming up from Montgomery County, and a lot of school districts are opting to go virtual.
Right.
Child care centers are charging upwards of $1,600 a month per child.
Yeah.
Personal people to come to your home could be $2,500. Is there you've talked about making sure child care centers have funding to stay open. What about the other side of that? Is there any conversation or any help for parents to afford those costs?
Yeah, I mean, first of all, I recognize that as a problem. We've given already $100 million from the CARES Act money through the state to child care centers to keep them open, because we recognize how important that is to allow parents to go to work. Is there more to do? Absolutely. So we'll continue to look at that. I think Department of Education is now working with Penn State on a study to figure out exactly what the need is and how we can intervene in a maybe even more robust fashion. But again, this is a problem that I've recognized since the beginning of this pandemic, and I'll continue to address it.
As part of that, if there's funding for these child care centers, is there kind of a back end of that saying make sure you make it affordable and don't put parents
Yeah,
through
no,
a
that's a
limit?
good point. I think if all we're doing is increasing the revenue and not really helping parents here, the idea is to help parents, is to give them an option so that they can get back into the workplace and feel safe regardless of what the school is doing. If they decide to open or in person or do virtual training, that they are going to be able to afford to go to work. Yeah.
Yes, Governor. The PIAA had said last week that it was following Wolf administration guidelines regarding no spectators at sports events. There have been petitions out signed by thousands and some efforts trying to get some parents to be able to go to these events. Any thought of revisiting that?
Yeah, I mean, the original, we worked with PIAA back when we thought things were pretty much flattening out here. Now we're in a new situation, and they're not. And school districts are looking at their each of their situations differently. And what I've said is and I'm not sure we figured out exactly how we can do this, but what happens in the schools should be consistent with what happens in the playing fields. In other words, if the school is going completely virtual, it seems hard to justify having in-person contact sports being played in the fall. If the school's going to be open, feels it's safe, and the teachers, administrators, parents feel it's safe to reopen, then that's a different proposition for contact sports. But I think I'm trying to allow for different situations in different parts of the state, because we do have some diversity, and that their sports decisions and their education decisions ought to be governed by what's going on locally.
Is there a chance that parents could be allowed in a limited fashion by social distancing to sports events if they do go on?
Yeah, we haven't decided that yet.
We'll have more information for you in 2 days, sir.
You heard it from Secretary Levine. In 2 more days, we'll have more formal guidelines. This is I hate to sound fuzzy here, but this is a work in progress, and the situation changes every day across the state, and within the state, and any given day, it's very different from one region to another. So we're just trying to keep up with the virus and trying to give the guidance that we can to help parents feel, and the students feel, the teachers and coaches and administrators feel that they can safely come back to education. Yeah. Yeah, I think this is the last one, right? Okay, you're the last.
Financial help for restaurants. You've said a lot today, and
Yeah.
the others who have talked about enforcement at restaurants potentially. There are a number of people who have talked to restaurateurs over the last week or so who have told me that at 50% seating limit, it's close to whether they'll be able to make money. At 25%, a lot of them can't.
Right.
A lawmaker I talked to said he is going to float a bill about waiving the requirement to turn over sales tax during the rest of the pandemic. The restaurants would get to keep the sales tax. It's just a memo right now.
Yeah.
Would you consider something like that?
Yeah, I don't know if I'd consider that particular one, but financial support is absolutely essential, and I'm in support of. There is one bill at the federal level called the Restaurants Act, which is $120 billion, I think, that would go to restaurants, and I think that enjoys bipartisan support, and I think that's a great idea. I've talked with leaders, Republicans and Democrats, about what we can do here. And I think there's some thought about that. I think one of the things we probably want to do is see what Washington does when it comes to CARES Act funding for the state, so we have a better sense of what our revenues are going to be. But yeah, I think again we're fighting this virus, and it's absolutely true that the fight against this virus does weigh more heavily on some than others, and we ought to be sensitive to that. We ought to recognize that whatever wherever that falls, the virus is still going to do what it's going to do. And I think what we ought to figure out is not how can we try to be more friendly to the virus, but how can we support the organizations and people who are hit hardest by this pandemic. All right, thank you very much, everybody. Thank you again.